Hi everyone, Dr. Jeff here with you today. The theme of the month here at the Goals of Wellness Center is on pregnancy. So I thought today we talked a little bit about nutrition in your pregnancy. And it is important to think about this prior to getting pregnant. So even 3 to 6 months before you get pregnant, think of changing your lifestyle to get yourself ready and get your body ready to be pregnant. It is a myth that you need to gain or eat for two when you're pregnant. Your weight gain will go up. It's based on your body mass index. So the first trimester you may gain a couple pounds, but your second and third trimester you may gain between 20 and 35 pounds depending on your body mass index is concerned. But increasing your snacks in the second and third trimester is all you need to do. You're not eating for two. That's a myth. As far as eating is concerned, stay on a regular good eating pattern, making sure you eat lots of good fruits and veggies, whole grains, milk alternatives. Lean meat, if you don't like lean meat, dried peas, lentils, tofu, things like that. Things you might want to avoid, one is smoking. Smoking is bad for you, it's bad for the fetus. It introduces over 4,000 toxic chemicals to the fetus. It does cross your placental barrier to the fetus. They have found women that smoke, they'll have less weight gain, the fetus is less weight gain. They'll actually lead to more health complications, both in vitro and afterwards, and also have an increased chance of miscarriage. Right? As far as multivitamin is concerned, get on a multivitamin 3 to 6 months beforehand. Make sure the multivitamin has folic acid in it. Folic acid is very important for birth defects and decreasing the chance of birth defects. Also, vitamin B12 and iron. Your fetus has to actually develop its own blood system, and so instead of stealing from you, you need to actually give it enough iron and B12 so it can develop its own blood system. Also looking at fish oil. Fish oil is very important for everything. If you are eating fish, they say maybe 2 meals a week in fish because of the mercury that might be involved in the fish, but fish oil is perfectly safe to take. If you're checking your multivitamin, make sure it has less than 10,000 international units of vitamin A. They found anything over 10,000 units may lead to possible birth defects with that much vitamin A in you. Caffeine, maybe 2 cups a day. Try and keep it limited because that actually does cross the placental barrier as well. Look at the herbal teas. There are some safe ones, some not safe ones. There's still research is still up in the air with your herbal teas. You may want to Google on the Health Canada website into what may be good herbal teas to drink. As far as other things to avoid, raw fish, so oysters, clams, things like that. There's too many parasites and things that could be involved in that. Making up things with raw eggs. We have a favorite Caesar salad dressing we like to make up with a fresh yolk. So you may want to look at that because again, there could be contamination in that at all. Alcohol is very bad. There used to be research showing that maybe in moderation 1 or 2 drinks a day, but they're now showing that avoid alcohol as much as you can during pregnancy because then it crosses the placental barrier and can lead to decreased brain growth in your fetus. They also have found that oral health, if your body's not getting enough nutrients and vitamins and stuff, the fetus will steal from you. And the place it likes to go is your teeth and your bones, because that's where most of your good minerals and things are. So it actually steals from your teeth. Your teeth will get softer, you get more cavities, more periodontal disease, more inflammation, more infections, and that leads to, again, complications with your pregnancy and complications with your fetus. So make sure you take good care of your teeth, make sure you're getting good multivitamins to make sure the fetus is getting what it needs. So if you're thinking about getting pregnant, think about changing your lifestyle, think about getting healthier 3 to 6 months before you actually get pregnant. Make sure you're in a good state, your body's in a good state to get pregnant because it is very taxing your body when you're pregnant. If you have any questions, you can always email me at jgoalswithy@goalswithyWellness.com. You can reply to me on email. I'm Dr. Jeff. I've got your back.